welcome to the Nurses Corner brought to you by the Dr. Oz Show. I'm Brenna Bells. I will be your host today. Today on our panel we have Veronica Lungs. She is a nurse who specializes in respiratory diseases. And we have Jen Flem, who's our respiratory therapist. And then we have Lisa Bloat, who actually is a GI nurse who helps out with and specializes in patients with cystic fibrosis, which happens to be our topic of discussion today. Why don't you tell us a little bit about cystic fibrosis?
Well, sure. It's actually a chronic multi-system disease. It involves the GI tract and also the respiratory tract. It causes thickened secretions, which clog up different areas of the body, causing chronic hypoxia and malabsorption problems, and it's actually a life-threatening disease. It's the most common disease of the respiratory system in children and young adults.
Interesting.
Welcome back. Today our guest is Sarah Sweater, a 25-year-old female who was diagnosed with cystic fibrosis at the age of 2. Sarah, how are you today?
I'm good, how are you?
Good. Well, thank you for being on the show with us today.
Thank you.
Sarah, can you tell us a little bit about yourself and your daily routine living with cystic fibrosis?
I sweat constantly and I sweat all the time, so it really interferes with everything. Everything.
Does it make it hard for you to go outside sweating that much?
It makes it so hard. It's so embarrassing. Look at yuck.
That's pretty bad. That's really bad. What kind of treatments do you need to get?
Well, this is all my medication. I brought it to show you. And every meal I have to take about 15 to 20 enzymes.
It's okay.
Bless your heart.
We thank you for being on the show with us.
Yeah.
Allowing us to let others know about what you're going through.
It's very therapeutic to open up. Just remember that. It's okay to cry.
I have a lot of coughs. I'm crying with you. Phlegm.
It's very emotional.
It doesn't stop, ever.
Now, speaking of emotion, we've heard that you had a family member with this disease also?
I did. My sister. She passed about 5 years ago from the same thing.
Sorry to hear that.
I'm sorry about your loss. I do want to tell the audience too that cystic fibrosis is hereditary. It takes both parents to have the gene in order for the children to have it. So I am sorry. Was it just you and your sister?
Yes. She didn't sweat as much.
What are things that you do to help with the disease right now that you're doing?
Well, I try and exercise a lot.
Good.
It helps loosen my phlegm. Yes, I have to take all my medication every time I eat. Every time I want a snack. It sucks.
That's terrible.
Yeah.
Now I know that with the GI issues that you have with cystic fibrosis, the malabsorption problems, do you eat a lot of, what kind of foods do you normally eat?
We recommend a high protein and high calorie diet. Is that what you
Yes, I have
try
that.
to stick to?
Yes.
Okay.
I have that.
Is it difficult to find foods that meet those requirements?
No, Mom makes them for me.
She does.
Yeah.
Good.
Yeah.
And how often are you in the hospital?
Probably about once every 2 months. Something gets clogged up.
Well, that's actually pretty good though. So you do take care of yourself.
Yes, I try.
Good. Now, are you on any kind of special antibiotics as well, or do you just know that once you start feeling you have shortness of breath and
Sorry, I'm sorry.
It sounds like you need a breathing treatment.
You know what? Which brings us to another great thing. We have our respiratory therapist here. This is Jen Flem. She's our respiratory therapist, and she's going to actually be able to demonstrate today how to improve the patient's breathing.
Yes.
I just had pneumonia, so I'm still kind of getting over it.
Not a problem. Do you mind if I actually take a listen to your lungs?
No, not at all. Just don't mind the sweat.
That's okay. Audience, I'm going to have Sarah turn around so I can show you how to properly check the lungs down.
Now, Sarah, do you have this performed at home, the chest physiotherapy? Then actually do the chest percussion?
Oh yeah, all the time.
Does someone at home do that for you?
Yes.
Okay.
Well, I'm going to have you still turn around. around. So what I'm going to do is I'm actually going to pound on your back, and what that's doing is actually loosening up the mucus in your lungs.
Okay.
It makes it easier for you to expel it on those coughs.
Okay.
So all I'm going to do is just kind of do a little bit of a pounding sensation. Do you feel it helping a little bit when you cough?
Oh yeah.
Okay, good.
Now, as Jen does the chest percussion, when they're little, you'll need to do this as well. But another great breathing exercise for infants and for little children is to encourage breathing exercises, is to blow bubbles or pinwheels or do anything like that. Well, that is fun, but yet promotes them to get their lungs expanded.
And as Sarah already said, she has had pneumonia recently, and so something very important is to keep that mucus expelled so that you can minimize your risk of infection. And also, like we talked about, the diet, you want to be high calorie, high protein diet, and you also want to monitor their weight. And Sarah brought her enzymes today, and those are very important to prevent any GI problems.
The enzymes helps with the absorption of fats and proteins, which is difficult for cystic fibrosis patients to absorb. Weight is actually important. It's very important because they tend to have a lack of appetite. So earlier on in the stages, it's an increased appetite, but as they progress, it becomes a lack of appetite.
You also want to encourage them to get yearly influenza vaccines. Do you get a yearly vaccine?
Yes, every year.
Very important because they're very susceptible to that kind of thing.
And as everybody always stresses, if you're given an antibiotic, take it not until you start feeling better, but take the entire amount, the full dose of it. Very important. And water, can't get enough fluids.
Okay, I'd like to thank Sarah for coming in today. She's really helped out a lot of patients with CF out there who need more information or looking for signs and symptoms. And also, as a GI specialist, I'd like to remind my patients about fluids, plenty of fluids. That helps with constipation, and also monitor for signs of bleeding for the malabsorption.
Of the vitamin K.
Of the vitamin K. And encourage frequent rest periods between exercise or activities.
Definitely.
That always helps.
Definitely. Thank you for those tips. We really appreciate it. Well, that concludes our session today of Nurses Corner. We appreciate you watching. And if you have any questions, you can get some information off our brochure, which we will be providing to the audience in just a few moments. And thanks again.
Two, one,
Welcome back. Today our guest is Sarah Sweater. Dang it, didn't it?
one.
It's really hard. I can't sleep. I sweat all the time. So it really sucks and interferes with my love life.
Three.
Wait, where are we starting?
I know. We're starting all over.
Why are you over there?
I know.
Sorry.
Rob's gonna sit in.
Where are we starting?
Okay.
Good morning. Welcome to the Nurses Corner, which is brought to you by the Dr. Oz Show. Today on our panel,
Okay. You said shit.